Now we'll be talking about heart failure in children, and we said that the causes are many, which in the previous lectures we just listed them out. Do you understand? So I think it's nice that we classify these causes. Like, let's reclassify them. You understand? Into cardiac and non-cardiac causes. Like, the child is having heart failure because the issues is primarily from the heart. That's cardiac causes. Then the child is having heart failure because issues are from other organs of the body, but these organs are vital, okay, because collectively they make the heart function properly. So if an organ is failing elsewhere, or there's an infection or any disease condition, the effect can now be reflecting on the heart up to when it gets to heart failure. Do you understand? So let's look at this classification, all right, of heart failure causes in children. So what we have as an introduction, we said that heart failure can arise from a lot of causes, all right? Now these causes, we classify them into cardiac. That's the ones that is from the heart issues, then also classify them into non-cardiac. So for cardiac ones, it's also classified into the ones that you were born with it, that's congenital. Then also the ones that later on in life, some issues came up, you had it. So let's look at the cardiac one. When we are done, we'll look at non-cardiac. So under the congenital is ventricular septal defect. I've spoken about all of them individually. If you want to know more about any one of them, just comment. Alright, then I'll share you a link of the video to watch. Patent ductus arteriosus, transposition of the great arteries, total anomalous pulmonary venous drainage, coarctation of the aorta. Okay, then for acquired ones, that's issues came up later, alright, okay, within the childhood though, valvular heart disease, infective endocarditis, myocarditis, cardiomyopathies, then sometimes post-surgical complications. Okay, so non-cardiac causes, you understand, that's like some other disease conditions in the body, but their effects is now gradually being reflected on the heart. So severe anemia, so oxygen delivery is not much again. Do you understand? So it's making the heart beat very, 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 very fast. Okay, thyrotoxicosis, excess thyroid hormone is making the heart work so much. Beriberi, thiamine deficiency, okay, is leading to high output heart failure. Alright, septicemia, there's an infection and it's going into the bloodstream. It can even infect the heart muscles. Okay, renal failure, okay, leading to fluid overload. The heart is dealing with too much fluid. Alright, then asphyxia, cardiomyopathy. Okay, then pulmonary diseases like what? Pulmonary dysplasia or cystic fibrosis. Okay, let me just snap this: asphyxia, cardiomyopathy. The name seems new to me. Alright, so that's it for the cardiac and non-cardiac causes, of heart failure in children.